So today is the cardiac cycle, the continuation of the cardiovascular system. Cardiac cycle. The various cardiac activities in the heart from beat to beat is called cardiac cycle. The heart contracts and relaxes. The period of contraction and relaxation is called systole and diastole respectively. The cardiac events that occur from one heartbeat to the next beat is called cardiac cycle. It is associated with the abrupt and spontaneous development of action potential in the SA node stage of cardiac cycle. Each cardiac cycle lasts about 0.8 seconds and consists of 3 phases: arterial systole 0.1 second, ventricular systole 0.3 second, complete cardiac diastole 0.4 second. The number of cardiac cycle or heartbeat ranges from 60 to 80 times per minute. Average beat 74 beat per minute. Superior and inferior vena cava transport deoxygenated blood into right atrium. At the same time, 4 pulmonary veins drain oxygenated blood into left atrium. The atrioventricular valve open and blood flows through the ventricle. As SA node stimulates, it causes atrial contraction or systole. When impulse travels to AV node through bundle branch of Purkinje fiber, it is spread into ventricular muscle and ventricle gets contracted or systole. After ventricular contraction, it recovers by whole cardiac relaxation. Heart sound. The mechanical activities of the heart during each cardiac cycle produce some sound called heart sound. These sounds are produced by the movement of blood passing through chamber, contraction of muscle, and closing of the heart valves. Types of sound. First, heart sound S1. This is produced by closure of atrioventricular valve, that is AV valve, tricuspid and mitral valve. It is produced during systolic phase. This is long, soft and low pitched. Second, heart sound S2. This is produced by closure of semilunar valves, that is aortic and pulmonary valves. It is produced at the end of the diastolic period. This is short, sharp and high pitched. Third, heart sound S3. This heart sound is low pitched sound and is produced during filling phase of cardiac cycle. Fourth, heart sound S4. This is an inaudible heart sound produced during arterial systole. Blood circulation. It is of 4 types: systolic, systemic, pulmonary, portal, fetal or vital. Pulmonary circulation. Carry blood and from the lungs. They include the pulmonary artery and its branches to the capillaries in the lungs, as well as the veins that drains those capillaries. The pulmonary arteries carry blood low in oxygen from the right ventricle, while the pulmonary veins carry blood high in oxygen from the lungs into the left atrium. This circuit functions to eliminate carbon dioxide from the blood and replenish its supply of oxygen. Systemic circulation. It is the largest circulatory route. It takes oxygenated blood from the left ventricle through the aorta to the all body parts of the body, including some lungs tissue, not air sac or alveoli, and returns the deoxygenated blood to the right atrium through the systemic veins, the superior vena cava, the inferior vena cava, and the coronary sinus. It has several subdivisions. Two of several subdivisions are the coronary circulation and the hepatic portal system or circulation. Portal circulation. In all the circulation, the venous blood passes from the tissue to the heart by the most direct route. In the portal circulation, venous blood passes from the capillary bed of the stomach, spleen and pancreas to the liver and then to the heart by systemic circulation. In this way, blood with a high concentration of nutrient goes to the liver first. In the liver, certain modifications take place, including the regulation of the nutrient supply to the other parts of the body. Portal vein. This is formed by the union of following veins, each of which drains blood from the area supplied by the corresponding artery: splenic vein, inferior mesenteric vein, superior mesenteric vein, gastric vein, cystic vein from gallbladder. This portal vein carries blood to the liver, which is collected by hepatic vein. Hepatic vein then drain into inferior vena cava. Fetal circulation. It is very important. In uterus, mother and fetal blood not mix unless there is some pathological condition. There is only the exchange of carbon dioxide and oxygen and nutrients within the capillaries inside the placenta. There are 4 temporary structures which initiate the fetal circulation or differentiate between adult and fetal circulation. ductus venosus, foramen ovale, ductus arteriosus, hypogastric arteries. From the placenta, blood passes through the umbilical vein through abdominal wall to the liver, which carries oxygenated blood. In liver, it gives branches which receives deoxygenated blood from liver. In other branch, ductus venosus mixes with inferior vena cava, which collects impure blood from the lower limb. Then the blood goes to the right atrium through the foramen ovale. The blood passes into the left atrium. The blood then passes through the mitral opening to the ventricle and pumped into the aorta through aortic valve. The brain, heart, upper and lower limbs of the body supply oxygenated blood from its branches. The blood is collected from the upper part of the body, returns to the right atrium by superior vena cava. This stream of blood is depleted of oxygen and nutrient. It goes to the right ventricle, which then is pumped into pulmonary artery. The blood is supplied to the lungs for development. The remainder blood passes through the temporary structure ductus arteriosus in the descending aorta. It branches off into iliac arteries, which go to the placenta known as hypogastric arteries. They carry deoxygenated blood from the fetus. This blood is again deoxygenated by placenta and the cycle is continued again.